Houston has been known as one of the top cities for allergic rhinitis, or more commonly known simply as allergens. Allergies occur when your body is exposed to seemingly harmless allergens, the most common being weeds such as ragweed, grasses, trees, mold, and dust. For sensitive individuals, your body may mistake these allergens as harmful and your body may release a substance called histamine. Histamine in the body leads to many of the symptoms that are associated with allergies, such as sneezing, itchiness, watery eyes, runny nose, itchy throat, stuffiness, and fatigue. As allergies worsen and your nose and throat become more inflamed and irritated, you may develop secondary problems of allergies, including nasal polyps, recurrent sinusitis, postnasal drip, ear infections, and asthma. Most people do not know how to properly address their allergies, aside from taking allergy medications. Although medication is an important aspect of treating allergies, it is certainly not the most important way to manage allergies. There are 5 steps to manage allergies. The first step is avoidance. The best way to deal with harmful allergens is to avoid them. For instance, a common allergen is dust mites. Dust mites are microscopic bugs that literally live in your mattress, pillows, and carpet. These mites crawl on you at night and cause you to wake up with allergy symptoms. To avoid them, you can use dust mite covers on your mattresses and pillowcase, remove old rugs and carpets, and wash your sheets in hot water. These techniques alone can significantly reduce your symptoms. Other common allergies that respond to avoidance techniques include mold, cats, dogs, feathers, and of course foods. Harmless allergens such as pollens are too difficult to avoid since they are in the air we breathe, making it impossible to avoid. You cannot begin to avoid your allergens until you know what you are allergic to, and that's why proper allergy management always begins with allergy testing. To accurately diagnose your specific allergens, Dr. Pasha's program uses 2 methods. Prick testing is mainly used as a screener and to identify potential food allergens. Prick testing is done quickly and is completed within 10 minutes. Skin endpoint titration, or SET testing, is considered the gold standard of allergy testing. SET testing is the most accurate way to not only identify your allergens, but also determine how allergic you may be to a particular allergen. Please note that Dr. Pasha does not feel that blood testing is accurate enough for a successful program. The second step in managing your allergies is medications. The most common medication are antihistamines. Antihistamines are available as a prescription as well as over-the-counter. Common brand names include Benadryl, Claritin, Clarinex, Allegra, Zyzal, Allerex, and Zyrtec. Antihistamines work against the agent that causes allergy symptoms, histamine. Antihistamine should only be taken when symptoms arise or when you anticipate exposure to allergens. An example of this would be exposure to grasses, ragweed, or trees during allergy season. Antihistamines can also be taken in forms other than a pill. Common forms include nasal antihistamine sprays such as Astelin and antihistamine eye drops such as Patanol, Pataday, and Optivar. These drugs are used as needed for specific complaints like watery eyes or nasal itchiness. Nasal steroid sprays are also commonly used and are available as prescription only. These include Nasonex, Flonase, Rhinocort, Nasocort, and Veramist. These types of nasal sprays reduce the inflammation caused by allergies, controlling your sneezing, runny nose, and congestion. Nasal steroid sprays must be used on a daily basis, as it takes several days to take effect. Dr. Pasha may also recommend anti-leukotrienes such as Singular that reduce delay allergy symptoms, like nasal congestion, and also treats asthma, a commonly related disorder. Other medications for allergies include saltwater sprays, which clean the nose of allergic particles and decongestants. Although medications are commonly used to control the symptoms of allergies, none will address the underlying cause of allergies, thus limiting their long-term benefits. The third way to address allergies is by using corticosteroids. Steroids reduce the inflammation caused by allergies. Dr. Pasha uses steroids sparingly, limiting their use for severe reactions, persistently intolerable symptoms, or for recurrent nasal polyps. Short-term side effects include weight gain, mood changes, headache, upset stomach, and may worsen your blood sugars or blood pressure. Long-term steroid use may elevate your cholesterol, cause brittle bones or fat deposits, thin the skin, and cause cataracts. The fourth way to deal with your allergies is to address the secondary effects of long-term allergy exposure. Untreated allergies can lead to many secondary effects, such as recurrent sinusitis, asthma, nasal obstruction, ear infections, and hoarseness. These complications are discussed later and often have to be dealt with separately. Finally, in order to obtain long-term benefits, immunotherapy or allergy shots are the only solution available. Immunotherapy is the mainstay option in treating the underlying cause of your allergic response, rather than treating only your symptoms. Immunotherapy is especially ideal for those who cannot avoid their allergens and who have severe allergies, or who wish to be off of medication. Immunotherapy has been proven to produce the following potential results: less dependence on drugs and medications, less chance of developing a severe life-threatening reaction to pollen, such as anaphylaxis. Reduce your symptoms caused by allergies such as watery eyes, sneezing, nasal congestion, and runny nose. Immunotherapy works by reducing your sensitivity to your allergens. As you progress through your course of treatment, your body becomes less reactive to your specific allergens. Although immunotherapy does not work for everyone, the success of immunotherapy program depends on your technique. The first step of immunotherapy is with accurate allergy testing. Skin endpoint titration, or SET testing, is the most accurate way to determine how sensitive you are to each allergen. Using these results, we calculate the concentration of each allergen to create a vial or serum extract specifically for you. The Pasha Sinus and Allergy Center formulates our own vials in-house. This allows us to accurately adjust your serum without delay. We use meticulous techniques to create our vials so that you receive the maximal benefit for each round of therapy. The next step in immunotherapy is to test the serum on you. The most important concept in immunotherapy is that we will give you just enough allergen to allow your body to build up its own sensitivity without causing you to have symptoms or a severe reaction. Once we've created your serum, we will have you come in to test your vial. It is important that you have not taken any antihistamines for 3 days, such as Allerex, Zyzel, Zyrtec, Benadryl, Claritin, Clarinex, Allegra, and Astelin. Please also be conscious of the over-the-counter medications that have antihistamines, such as many cold and sinus combination drugs and sleep medications. Steroid nasal sprays, Singular, and decongestants do not interfere with our testing. In testing your serum, we place the extract under your skin like we did for skin endpoint titration. After 10 minutes, we will measure the response to make sure that we have not given too much allergen, which may cause you to have allergy symptoms, or not enough, which will not stimulate your immune system to reduce your sensitivity. Once we've adjusted your vials, you're on your way. We will then see you the following week as we teach you more about allergies, and if you choose, we will teach you how to give your own allergy shots. During this period, we will also adjust your medications and make sure that you understand comprehensive allergy management, including how to reduce your allergen exposure in your home and work. If you are comfortable, you may take your vials home after a few weeks of training, or you can come to the clinic weekly to have your injection given by one of our trained staff. If you take it home, we will have you return after 2.5 months in order to increase the concentration of your vial. Home immunotherapy is easy to do for both adults and children and is ideal for those of you who are busy or travel. Home immunotherapy allows for better compliance and long-term success, as you do not have to come to the clinic every week. Both home and in-office therapy is available to you depending on your own personal level of comfort. A proper immunotherapy course varies from months to years depending on each individual. Immunotherapy in general is 85% effective in reducing symptoms and decreasing sensitivity. Our program is designed to not only wean you off of medications, but ultimately take you off your allergy shots altogether. Congratulations on seeking long-term solutions to your allergies. We hope that with this understanding, you may consider our immunotherapy program. Please allow our staff to answer your questions and concerns. We look forward to allowing you to breathe freely, day and night.